I'm Matt Willis, Public Health Officer from Marin County with a COVID-19 update for Friday, July 16th. Today, Marin County joined 7 other Bay Area counties in a joint recommendation for all residents to continue to use face covering in indoor public settings for unvaccinated as well as vaccinated people. Here's why we chose to take this step. If you've been following our case counts, you know that COVID-19 is making a resurgence. We've seen quadrupling in cases in Marin over the past month, from less than 1 to 4.4 cases per 100,000 residents per day. This is consistent with patterns seen across the region, the state, the nation, and in most areas globally. In fact, our rates are still significantly below the state average, but the trend is concerning. We see 2 significant contributors to this rise. The rise began about 1 week after the June 15th reopening, with another jump after July 4th. So some of it is the increased interactions that go along with reopening, and this was expected to a certain degree. But the other more concerning contributor is the Delta variant. Through our work with laboratories, we have a pretty good sense of the prevalence of variants in our community. Delta has been increasing weekly, and now makes up 80% of all samples tested last week. This data is now available on our website for the public to see. The main feature of this variant is that it is more contagious. So some interactions between people that in the past would not have led to infection now do. Put simply, the virus is more contagious than it used to be. This also means we're seeing more cases among people who are fully vaccinated. In Marin, over the past week, approximately 1 in 4 new cases were people who were fully vaccinated. 83% of our breakthrough cases were infected with the Delta variant. It's important at these times to step back and remember the overarching goals of our pandemic response. Our public health goals are primarily to prevent severe illness and death. Since June 1st, only 2 of 137 breakthrough cases have been hospitalized, and none have died. In fact, no Marin resident has died from COVID-19 in the past 2 months, and that's mainly because of the vaccine. The vaccine is strongly protective against serious illness, even against the Delta variant. This is why vaccination is even more important now than ever. A more contagious strain, unfortunately, means you're more likely to be infected by definition. But the vaccine can help make sure you don't end up in the hospital. The mask recommendation is a basic measure to limit the infections that can happen in indoor public places, and is a response to the evidence that the Delta variant is finding unvaccinated people, even in communities like Marin, where 85% of the eligible residents are fully vaccinated. 2 weeks ago, the New York Times said that Marin County had virtually eliminated COVID-19 as among the most highly vaccinated counties in the nation. On the other hand, now some are referring to this as a 4th surge. The truth is somewhere in between. Clearly, this isn't eradicated or eliminated. But this surge in cases is not the same and doesn't carry the same threat as those that happened before the vaccine. Even if more contagious strains increase infection rates, our high vaccination rates protect our hospitals and our community from surges in critically ill patients. Any success we've had in fighting this pandemic in Marin is because we've come together, and by using the tools available to us at every stage, we have some control over our shared risk. Right now, taking the simple step of covering your face indoors when you're out in public and getting vaccinated, if you haven't yet, are the 2 most important things you can do to put this behind us. Thank you for doing your part.